Let's start here. We just survived the 45-day general legislative session. How many does that make? Let's start with Francis. How many does that make for you?
20.
20?
20 years.
Okay.
So it's been a lot.
20. Let's see if Dave can beat it. I'll bet he can. Dave, how many was that for you?
It's been 32 with the Hospital Association.
32 with the Hospital Association, but it's a little more than that.
I spent a few years in another employer.
Yeah.
Came up.
So let's give you credit for 34. Does that sound right? Okay, 34. Well, you're the KG veteran here, and the rest of us are just young pups going through these sessions. But we survived it, and we've survived the week of recovery. That's the most important part of the session. Dave got down to St. George, got a little sunshine, so that's great. But let's talk about what was accomplished during that 45-day session. Francis, what would you say is the biggest win for the Hospital Association this session?
Well, I think we're going to come and we'll discuss the $300 million cut later. But, going to the session, every committee was asked to cut 5%, and the Social Service Committee was a little bit more aggressive, and they went up to $200 million at one point. And then they looked at really all Medicaid providers in the state and said, what is realistic? And so that was pared down to about $20 million. So I felt like overall budget cuts, that was a great one. And there was another bill, Senate Bill 305, which allows hospitals, if they meet certain quality metrics, to be able to assess themselves and draw down extra funds from the federal government. And that was Senate Bill 305. Big deal for hospitals because I think each of us are doing good work, and this is just an opportunity to enhance the quality of work that we're doing and receive additional reimbursement for those efforts. And so that was a big deal, especially in lieu of some big cuts that are coming up.
Yeah, Dave, 34 years, you know that there's winning, and sometimes winning is not losing by so much, and sometimes winning is actually winning. Did you see a bit of that this session?
Yeah, a bit of both, but I will just echo Francis on the Senate Bill 305. In my many years of doing this, that's probably got to be a top 5 or 6 bill as far as funding levels that we've been able to get for the hospitals. So that's a big win for us. And the other thing I would say overall is, for some reason this year, we saw what I'd call quite a few small mandate bills on hospitals, trying to tell hospitals what to do in certain areas. There was about a dozen of them, which was quite a bit more than we've ever seen. And we were able to, some of those didn't pass. Some of those did pass with good amendments from us. And we, maybe a couple that were challenging or still will be for the hospitals to some extent.
Yeah, sometimes it's victory, sometimes it's live to fight another day. Francis, we got some cuts coming up for hospitals, about $300 million on the way. How does that impact your members, and sort of how do you go about that? Like what does that do for a hospital, and what's their next step?
So I think the big beautiful bill, HR 1 that passed, it's going to cut a directed payment program. It's a hospital assessment, and once again, it brings additional revenue to the state and to hospitals. $300 million, and it'll be close to $500 million over the next 5 years. That is very, very significant. I think hospitals are going to continue to have to streamline operations, make cuts, and where care is given. It's really going to hurt our rural hospitals in some areas as well. We've been blessed, and the rural hospitals of Utah have been able to stay open, and they've been able to do that in coordination, working with some of our bigger systems, whether it be through telehealth or other ways that the rural hospitals have been able to utilize statewide resources. But that can only happen so much. And when that happens on the federal level, and then they come back to the state level, and you have legislators who, quite honest with you, want to run your hospital business, not realizing everything that's going on, that's difficult. But we'll continue to try to streamline. And I think it goes back to what I've said before. Hospitals are expensive, we know that. But we're 24/7, 365 days of the year, and we capture everything. And there are a lot of people that don't pay. But when they walk through the ER, we're mandated to see those folks. And I would just say that there are other ways that we need to look at the healthcare continuum in terms of costs and what that looks like. From health insurers to pharma to manufacturers of equipment, there are lots of different people that play a role in this. So it's going to take everybody to make sure the hospitals can remain open. It's easy to pick on a hospital, but when you need it, you're like, man, I hope that's there. I hope they're open when I get there. And so far in the state of Utah, we've not had any hospital closures, and that is happening in other states.
We talked about this, I think, a little bit before the session, and as it was going on, the House turns over, like the majority of the House turns over, I think, like every 6 years, the Senate not quite as quickly. Do you feel like you're always in a phase of, you've got some people who get it now, and some where you're trying to make sure that they probably didn't run on hospitals, right? That wasn't the reason that they ran for the legislature, and suddenly they find themselves making decisions that really impact hospitals. Is there always that element of some of these folks, we've just got to make sure they get a baseline of understanding, and some they're in the the second year class, and some then they get what hospitals are all about. Do you get some of that, Dan?
Yeah, yes, absolutely. And it's part of our job to do that education, but it is challenging at times when you get a brand new legislator, maybe a 30-year-old, 35-year-old, no interaction with healthcare, and the first conversation to us from them is, I want to reform Medicaid. And they can't even tell me what the difference is between Medicaid and Medicare, at least is who they cover. So it'd be like me becoming a legislator and saying, I want to reform, the prisons without any experience with them or something. And most of them, as they get educated, they understand better. But can I circle back to just briefly on what Francis said earlier on the cuts? Let me put that in perspective for everyone. If the big, beautiful bill goes forward with all those cuts, and they'll be full in a few more years, that would be the equivalent of us going back to what we were paid under Medicaid about 15 years ago. So think of your own family budget or your salary or your business if you had to go over a few years back to what you were paid or made 15 years ago. That's a big hit on the hospital.
Especially if costs aren't going back 15 years
Well, yeah,
with it,
inflation's going up, right? So it's a double whammy. And the hospitals are going to be in a really tough spot because, as Francis said, people want the hospitals there. They want them there open all the time, and they want all the services. Most of our costs are the people that work there, the doctors, nurses, others. So you start cutting that kind of money out of the hospitals in this state, they're going to have to make hard decisions on what services they may be offering or how many employees they have. And again, some people might like that, but it's going to be really a challenge for us.
And Marty, if new legislators, I think I was a legislator, still recovering, 14 years, elected 7 times, enjoyed it. And I feel what they're going through. And I think when people look at their constituents, what's bothering you? Well, it's education to some form or another, and what that looks like. It's the cost of healthcare. And I think everyone just wants to try to make a difference to their constituents. And I don't ever blame anyone for that. I would just hope that if you have a healthcare question, then come and ask the people who run healthcare before you just all of a sudden pop up a bill that's been protected for a long time, and then it comes up. And no, for those legislators who are watching this, no problems. Run your bills, but let's visit with them. And sometimes we've got some legislators who are very good at that, and we've got others who would prefer not to have the conversation and just run the bill. But I think that's just part of it. You're always talking. You're always trying to help people see what's going on and help them understand healthcare financing and how that works. Because to Dave's point, a lot of people don't understand the difference between Medicaid and Medicare. What's an accountable care organization? How does non-insured work in hospitals versus insured? And so it's always a continuing education piece.
I would also add that I think it's good we have turnover in the legislature. There's a variety of reasons. Most House members are only there 4 to 6 years, Senate a little longer. At one point, way back in history, we looked at term limits. Well, we don't need that in Utah because I think they were 12 years. I think there might be 5 House members and 4 or 5 senators. So 10% of the legislature's been there longer than 12 years. So you want those folks because they're the ones that really understand the whole process and the different areas because they've been educated. But I'd rather have, the turnover, and that happens for a variety of reasons. But that does make sometimes our job harder because every 2 years, including this fall, we're going to have probably 20 new legislators. So a fifth of new legislators come in that we'll have to educate on our issues as well as everybody else that will have to educate them.
I kind of made the joke that nobody really runs on this is what I'm going to do for hospitals or against hospitals. But one thing that people do mention a lot in campaigns, at least in recent years, has been mental and behavioral health, that's a big issue in our state. So did the legislature make some progress toward helping people in the state get the treatment they need or do the things that we need to do to be in a better position when it comes to mental and behavioral health, Francis?
There is no answer, right, to that in terms of mental health is solved after the legislative session.
Yeah, it's probably, we hope so, but probably not, right?
Yeah,
but then we take steps in the right direction. It's probably all you can have.
I think our state, we avoided big cuts for our state mental hospital in Provo, and a little bit of increase there for those folks. We did have some other some funding increases for some providers There are some Medicaid providers who haven't had increases for over 5 years. And some of those Medicaid providers that treat our mentally ill are important. Why is that important for hospitals? Because they're our frontline defense. As a hospital, we're the last resort. And so whatever we can do to have some of our other mental health providers to get increases, to be able to take care of the folks in an outpatient setting or some other setting that prevents them from coming to hospitals, is a big win. And I know in the House and the Senate, they were able to come together at the end and give some of these folks some increases. You think about working with mental health patients and you haven't had a raise for 5 years. Now, we look at TSA, what's going on now. TSA hasn't been paid for a few weeks, and there's a lot of mental health cases that come through those lines after waiting for so long. But can you imagine not having a raise for 5 years and dealing with some of the toughest in our communities? And so I think though that didn't come to us directly, indirectly, it does benefit hospitals that when those providers are able to get a Medicaid increase to be able to keep their caregivers treating some of those folks.
Yeah, I would also add that it was good some of the things they didn't do. They didn't do any cuts and that were on the table. There were some bills that would have taken us backward, in other words, prohibiting certain procedures or ways to deal with mental health people that did not pass. And there were a few bills that were good that passed that I think improved the ability for us and many others that are in that space to do better care. One of the big ones was going to be better coordination between mental health providers and law enforcement and the prisons, because many times these people end up either in an emergency room or in a prison. And so there were some steps made there. Representative Steve Ellison is just fabulous on this. He gets the lion's share of credit over the last half dozen years of really improving both funding and how the laws work in this space. But it's an ongoing challenge, and that was one area they didn't fund new things that in the past they funded. Like we still need a couple what we call the 23-hour receiving facilities, particularly one in rural Utah, where people can come and get treatment, and often then they wouldn't end up in either jail or in the emergency room. So we got a ways to go, but believe me, it's a lot better than it was, a decade ago.
Yeah. You guys, we've talked about a couple of bills, but you really track somewhere north of 60 bills during the session. I know in some sessions it's a higher number than that. Anything else from that list of bills that you track this year where you say, this kind of stood out to me or something that would be worth mentioning?
Well, as I mentioned earlier on, I won't get into a lot of them, but some of them might know of those. But there were some bills that we're going to tell hospitals how to do things in certain areas that did not pass. A simple one would be that did pass, because we got them to amend it, was most hospitals already offer, if people want to be donors of their organs if they pass away. We do that through the driver's license and other things. The bill originally said we had to ask people that up front. And so think about that. You're coming in the emergency room, you're really sick or hurt. It's like, oh, by the way, if we don't say it that way, but if you die, will you be a donor? So we got them to
in
move.
a moment when nobody wants to think about,
right.
oh, let's work on not dying first.
That's
and
right.
Then we'll
So we've
figure it
got
out.
that now at the end, which is when you're discharged, where you already fill out some other forms that we can bring that up at that point. And then there were some others that were kind of worse than that didn't pass. There was. I'll just say that the one that is a hard one, and many people support it, is a bill that adds to the current federal and state laws on certain healthcare providers choosing not to do certain procedures based on their religious beliefs or their own conscience. And I think we struggle with that because it's going to be hard to define by the courts the way that bill was drafted. And most of those areas are already covered by federal and state laws. So, that's one, and I said that in things we sent out to the hospitals. You got to get your legal counsel to look at that one. And so it's not necessarily a bad idea. It's just that it took, 6 iterations, and it'll be a challenge, particularly for some hospitals.
But I think rather a bill, irregardless of the topic, there's always that unintended consequence. There's that what if, what happens if this happens, and you don't really think about it until a bill passes and then that situation arises. And then you've got a law that's very contradictory to the way you want to run a business or have a practice, whatever that may be. And so really trying to think and share with the legislature, you know, if this works, if this is passed, this is the application. And sometimes the bill sponsor may not have thought about that, and they're really good to negotiate, amend, maybe drop a bill, not having any idea that you're already doing certain things. And so going back to what I said before, I think it's just important that if you have a healthcare issue that could be hospital related, talk to the hospital folks and just say, if this bill passes, what does it do? How does it function? What's the ramifications if this happens? So.
And many of those bills seem really simple when a constituent or a spouse or a next door neighbor has asked the legislature to run a bill because they didn't have a good experience. And some of them are simple, like the organ donation one, but many are actually very complex for the hospitals. And some of them did not pass. And some of them were kind of, I don't know if it was voluntary, but they kind of withdrew them because they, once were educated, they understood how much more complex what they were trying to do would be. And the last thing I'll say on that is we have roughly, I think now 63 hospitals in the state. And so often, even on these mini mandate bills, maybe they would only cost us $10,000 in actual money or staff time. But if you add that up, that's $600,000. If there's 5 of those, that's $3 million added to the cost of healthcare, both for us and if passed on to the patients, at a time when almost everything they're asking us about is you're too costly. Let's bring back the cost of, bring lower the cost of healthcare. So,
right after the Super Bowl, they start to talk about who's going to be in the Super Bowl next year. Right after the presidential election, we start talking about who's going to run next time. So here's the way too early question. What's on the radar for next year's session?
You want me to take a stab?
Yeah, go ahead. You've had 34 opportunities. So.
Yeah, it's hard to predict, but Medicaid will still be a big deal because we've had some cuts already, but the real cuts will start happening, in the next year and then every year thereafter. And there'll be continued debate on Medicaid. One of the bills they passed this year was trying to deal with the work requirement, which kicks in within the next year. And one of the cuts on us dealing with Medicaid, they didn't make the cut, but they want to study that particular cut more. So that will be something we'll be looking at and educating and debating on. I think one of our, it's hard to predict. There's always bills out in left field, but I think that part of our efforts can be, as these new candidates are going to be coming out after caucuses tonight, as they get elected or get to the finals or the general election, for us to educate them on some of these things. I think we found that when they already know who to come to, when they already know and can ask us questions, there's more of a trust there, but also more of a, as Francis has said, hey, I'm going to call Francis or I'm going to call Dave because they seem to know what they're talking about in that space.
I think one of the good things that I maybe not have to worry about is a big, beautiful bill, Part 2. I was able to visit with one of our U.S. congressmen, and there were some things that I was really leery of what Part 2 may look like. He says, yeah, that's not going to happen. There doesn't seem to be any appetite to try to get another Part 2 through at this point. You have an election coming up, midterms. What does that look like? If you look at the president's approval ratings, they're not what he probably hoped they would be. However, historically, he's probably right where all of them have been midterm. And then you just got, every House member is going to be fighting for their own seat. Just look here in the state of Utah. We have a whole new design with redistricting came up. Without editorializing my thoughts on that happened. And so we're going to have a whole new potential congressman or congresswoman and what that looks like. So it just seems to be a lot of dysfunction. It's only this year that DC is dysfunctional. They've never been that way in the past. I don't know what's going on, right?
Out, don't worry.
It'll all be perfect. But so I don't think we'll have that. But the ramifications, as Dave mentioned, of the big, beautiful bill, Part 1, are true. And we'll have to continue to work on that. So,
one last one, really important to our rural hospitals and rural health care. One of the things that came out of the big, beautiful bill, because they were trying to lessen the cuts in rural Utah, which doesn't really play out that way, but it is real money. The state's got close to $200 million of new dollars that will go to help with rural health areas. Francis and I worry that a lot of it will end up being frittered away with vendors or even state agencies using a lot of it. but there will be significant money going out to the rural hospitals, to other rural clinics, rural providers. And that's, unless they change it, that's about that much money could go up or down for each of the next 5 years. So that will be something we'll continue to be heavily involved in and engaged in for our rural hospitals.
310-ish days until you're back at it. So get some rest, and we'll
Don't say that. That's depressing. No.
we'll come back for number 35. Thanks so much, Dave Francis. Thanks for surviving the session. Thanks for all you do.
Thank you very much.
Thank you.